It's all right. Could we start with David, the Red Cross, Red Crescent? I should say to our panellists before we start, and this is a housekeeping point, that everything you say will be on the record. So please don't let that restrain you, but just so you know.
Thanks, John. And maybe I should just say, first of all, that I have Parkinson's. So for those of you who see me shaking, trembling, it's not with excessive nerves or overexcitement to be on this panel, but don't be put off by that. I just wanted to comment on some of the points that Annie set out in the report, but very much to bring a perspective from the Red Cross, and particularly our partner, the Syrian Arab Red Crescent. And I want to just focus particularly on the situation in Syria, and I'm not going to comment really on Lebanon or Jordan. We, British Red Cross, have a long-standing partnership that goes back to the late 90s, actually, with the Syrian Arab Red Crescent. And one of the interesting lessons learned from us, actually, which slightly challenges a point that James said in the report, that there was actually quite good levels of preparedness with the Syrian Arab Red Crescent at a very low level investment over many years in disaster preparedness. And it was a real lesson for us. And one of the things the Syrian Arab Red Crescent fed back to British Red Cross, all those years of supporting us with emergency training, preparedness, logistics systems, local contingency plans paid off. Ironically, that we were just approaching before 2011, considering phasing out that support. It was very difficult to raise funds for the region and very difficult to secure disaster preparedness programming. And how ironic that in 2011, the Syrian Arab Red Crescent had to scale up to a massive level. So I want to first of all sort of really pay tribute to them, and I'm not, I feel a responsibility on the Syrian crisis wherever I go to acknowledge the work that they do, and I'm going to say a little bit about it. But one of the points that James comments on is scale up. Actually, the Syrian Arab Red Crescent scaled up massively, more than many other Red Crescent partners I've ever seen in my 17 years with the Red Cross, and they're now delivering to 2.5 million people a month as a massive implementing partner of numerous UN agencies, other international organizations, but particularly the Red Cross movement. And I think I would very much agree with that comment, that important conclusion of the crisis being one of assistance and protection. And I want to just share some reflections on that. Particularly, it's not just rather it being one of protection rather than assistance, although there are some real humanitarian outstanding needs that if we focus purely on protection without recognizing what some of those assistance needs are, there are risks. But I think I just wanted to really underline the point, how ironic that we are discussing a review of the Syria crisis, and the report, the visit and the report did not even enable a visit into Syria. I can't think of many other contexts where we would be sitting discussing a review of a crisis where the main country at the center of the crisis was not visited. And I look at your comment, Annie, where you actually said, we don't know what is happening inside the country. And I think that is a really profound and alarming comment that I share. And the last OCHA report that I just read this week says that there are now over 6 million IDPs. The last report I read not so long ago, a month before, said there were 4.5 million. The actual scale of internal displacement and needs for us to be able to comment about whether this is just a protection issue or an assistance issue, I just don't think we have the information, the analysis, or the real inside understanding. SARC, who we work with, the Syrian Arab Red Crescent, in the most contested areas where they are active, they say that over 70% of the besieged contested areas are inaccessible. So I think today one of the challenges that I see with this report, and for us as a DEC and humanitarian community here in the UK, is that I think our understanding of the humanitarian situation within Syria is very patchy, and our delivery of addressing those needs is woefully inadequate. So James talks about in the report, and you mentioned this, Annie, that you both identified that we weren't prepared for the scale of the crisis, and I think that's a really important, and I still think our understanding of the scale of the crisis and the scale of the needs is something that would be important for us to acknowledge and maybe to discuss here today. this issue around protection and assistance, maybe just on the assistance side, in terms of some of the critical needs that we see still outstanding in country, particularly regarding food insecurity and health. We are supporting, and that we've used the DEC funds to support 100,000 food parcels. And we don't see an end at the moment in the need for food parcels, particularly as we approach the winter. So the long-term food security needs, and particularly in these besieged areas, and reading accounts from Moa de Meyer and other places of communities of people scavenging, increasing levels of malnutrition. The first recorded case of a child dying of acute malnutrition in Syria in many, many years. How one then starts talking about transition to livelihoods and longer-term food security and moving away from dependence on food parcels is a great problem. But when we engage with the Syrian Arab Red Crescent, their constant response is we need to scale up food parcel delivery, and we are very concerned about the food insecurity needs through the winter. The other area, just in terms of outstanding needs, humanitarian needs with regard to health, I think these are just exacerbated by the chronic gaps in the health system. The Syrian Red Crescent provides mobile health clinics, supports hospitals, and through an emergency medical service. They've seen a 48% increase in the number of patients at their health facilities in the last 3 months. So the health of the population is deteriorating, as well as, for all the reasons that we know. And again, you can look at just the shocking example of, there hasn't been a polio case for 14 years in Syria, and now there are 17 cases recorded as of last month. Massive gaps in immunization, real concerns around the deteriorating health needs. So there are, and we could all go on around some of the outstanding needs, but I think, again, it underlines to me the full picture and accurate evidence-based analysis of what those needs are should be of real concern to us, just how patchy that is. And then maybe to conclude with a few comments just on protection. I can't think of many contexts where the protection issue is, again, so complex for us to really have the full understanding on, and what can be done as humanitarian actors to address that, other than more robust humanitarian diplomacy and advocacy at the moment. But for the people besieged for 10 months in rural Damascus, and where many of these families and civilians caught up in the conflict are just totally inaccessible, to actually look at how one addresses those kind of protection needs of huge numbers of this displaced population. And as we know, huge parts of Syria remain inaccessible. I don't know how many people in here, as humanitarian professionals, have in the last 3 years been able to really access and talk firsthand of humanitarian delivery on the ground. One of the things that has been a challenge for many parts of the Red Cross movement is being able to deploy humanitarian professionals to support delivery. And it is actually only the bravery of the Syrian Arab Red Crescent that is enabling delivery. And as an organisation, as we've often cited, and the latest publication from HBG really focuses in on this, at huge cost to the security of humanitarian aid workers. And for the Red Crescent, 32 volunteers and staff of the Red Crescent have been killed since the outset of the conflict. And it's just worth reflecting on how does one approach that and respond as a humanitarian community. And again, I think there is a huge need for us in terms of humanitarian diplomacy to really, as a community, to stand together and to call for action for the protection of humanitarian aid workers in accessing populations in need and delivering their daily humanitarian duties. And for us in the movement, actually, it's quite an unprecedented, as you know, the Red Cross, which is very much stands on its principles of neutrality and impartiality, tends not to engage in wide public advocacy. But when I see the situation in Syria, I'm really heartened that as a movement we've launched a joint call from the ICRC, the Federation, and the Syrian Arab Red Crescent. And I brought those there, and that's really an effort from us as a movement in response to the situation of protection of civilians caught in conflict and humanitarian aid workers. So I think, for me, there is a reality context here that I wonder how much we really do have that understanding of the reality of the operational context. And I think that should shape our debate and maybe shape some of the realities of when we talk around accountability and some of the issues that were raised in the report that are very familiar themes, and it's a valuable report. But I think there is a peculiar challenge to the Syria context that we need to reflect on very deeply.
David, thank you very much indeed for that very vivid picture, and actually deeply troubling picture as well. You mentioned the HPN report, and that's a good cue for me to introduce Wendy, who I think is going to talk to that, I think.